Good afternoon. My name is Tarnika Manning, and I'm the Community Outreach Manager with the Metropolitan Chicago Breast Cancer Task Force. We are a nonprofit organization working to reduce the disparities in breast cancer mortality rates for women of color in Chicago. To learn more about our organization, visit our website, chicagobreastcancer.org, or check us out on Facebook. Our handle is MCBCTF, and on Twitter, say MCBCTF. You're watching a live call-in television show brought to you by Cable Channel 21, and we're online at cantv.org/hotline. During our show, we discuss various breast cancer issues that affect women of color here in Chicago. I invite you to call in if you have any questions during our show. The call-in line is open, and you can call us at 312-738-1060. Today, our guest is Maggie Osbourne, and Maggie is our Illinois Grassroots Manager for the American Cancer Society Cancer Action Network. She's going to tell us about all the wonderful initiatives they're working on at American Cancer Society. And anytime you have any questions for Maggie, give us a call. We're at 312-738-1060. Welcome to the show.
Thank you. Thank you so much for having us and giving us this opportunity.
It's been great working with you all. So we're really eager to talk to you guys about some of the great stuff you guys got in the pipeline.
Very cool.
But just tell us a little bit about your background.
Oh, sure. I am our Illinois Grassroots Manager for the American Cancer Society Cancer Action Network. And my background is actually in community mobilization with coalition building, as well as in work with advocacy and health initiatives with the American Cancer Society and ACS CAN.
All right. So, again, you told us a little bit about your title. So what exactly does your role consist of at American Cancer Society?
Oh, I have actually what I consider the best position with ACS CAN, which is grassroots means I get to work with all of our fabulous volunteers with ACS CAN, and that our volunteers consist of top level state level ambassadors for cancer issues that work at a federal level, as well as a state level, as well as local initiatives, ranging from those volunteers who like to send emails about things that are happening in Springfield or in DC, to those that actually make those trips to DC and have those one-on-one conversations.
All right. So you work for American Cancer Society Cancer Action Network. Mm-hmm. Can you tell us the difference between the American Cancer Society and the Cancer Action Network?
Sure. The American Cancer Society is a nationwide volunteer-based organization founded specifically for the elimination of cancer. We do that through prevention, through patient services, also through advocacy and research. And where ACS CAN comes in is we are solely based when it comes to our advocacy and policy initiatives. ACS, the American Cancer Society, created ACS CAN in 2001 specifically so we could go further in the advocacy initiatives towards making cancer a top priority when it comes to state level as well as national level.
Great. Again, we get a chance to work with you all at Cancer Action Network on a number of different campaigns. Yes. Can you tell us about some of the past campaigns led by ACS CAN?
Sure. Well, nationally, one of the things that so many of us are excited about that has been going into levels now are when we worked on the Affordable Care Act, specifically towards looking at affordable health care issues. So that is something we've worked on federally that we've seen great success. And there have been other things. Anything around cancer specific, when it is research based, is something that we make a priority. Mm-hmm. Statewide, probably one of the things that everyone remembers and turns to is our work and our partnership statewide as well as nationally when it comes to smoke-free initiatives. Mm-hmm. That's one of the things that we're most proud of. With Illinois has one of the most comprehensive smoke-free laws in the nation.
Excellent. And I know a lot of municipalities have been reaching out to you guys for some other like smoke-free parks and a lot of smoke-free areas. So you guys have done a great job doing the smoke-free Illinois. So. All right. So again, if you have any questions for Maggie, give us a call. We're at 312-738-1060. All right. So I know you're with the Illinois Division of ACS CAN. What are some of the federal issues that you guys are working on right now?
Sure. While I am Illinois-based, we're actually a part of the Lakeshore Division, which is Illinois, Michigan, and Indiana. But I specifically work with our national initiatives as well as our ones that are state-based. And probably one of the biggest things, and where we have a great partnership right now, of course, with the Metropolitan Chicago Breast Cancer Task Force, is in the area of looking at restoring or keeping funding for the Illinois Breast and Cervical Cancer Program. program. That's something that we, along with our partners, were very successful with last year with protecting that funding after it had been cut for multiple years. But this year, there are severe cuts that are being proposed, which we're going to talk about, that we are partnering and working specifically on. As well as in the state, we're working on issues when it comes to whether it's healthy eating and active living, looking at protecting physical activity for our youth, and then other issues, obviously, as they come up, whether it's patient-related care issues, things like that. It just depends on the issue, and if it's evidence-based, of course, we are putting our force behind it.
I know you mentioned some of the physical activity initiatives you're working on with youth. I think my niece is involved in some.
Oh, good. Wonderful.
It's something she's doing with walking or something. I don't know her school, but is that some of
Thank you very
our
much.
viewers might know something about that. All right. So again, you mentioned that we are working together here in Illinois on a number of different policies. So can you tell us more about your Illinois policy agenda?
Sure. Actually, that I was actually looking at specifically for Illinois. One of the big policy agenda issues right now is that protection for the Illinois Breast and Cervical Cancer Program. Would you like me to talk in detail on that?
Sure, go ahead.
Sure. We're actually alarmed right now. The governor has proposed over a 70% cut to the Illinois Breast and Cervical Cancer Program. This is very alarming for anyone in public health. When we're looking at these cuts, it's gonna it could result in less than half of the women being served who are eligible for that program, and so that is something that we're putting into the hands of our constituents across the state of Illinois to let their voices be heard on this issue and to reach out to the General Assembly on this, as well as to the governor, to let him know how disappointed they are in this decision that he's made for this cut for social services.
All right. So you kind of mentioned that half the women will not be served. Do you know how many women might be affected by these cuts?
Well, we know that one thing we do know is that in Illinois, over 9,000 women will be diagnosed with breast cancer this year. We're also looking at over 500 women with cervical cancer. So when you look at that and you look at also with the Affordable Care Act, you do see that coverage. And that's what some of the proponents of this say is, with the Affordable Care Act, we'll be able to have that coverage. But the fact remains, the Illinois Breast and Cervical Cancer Program is actually a safety net for women that are not yet covered by this program. Either they don't yet have insurance, or it's something still an affordability issue, or it's something whether in literacy or language barriers, they are not enrolled. And so this is something with the Illinois Breast and Cervical Cancer Program. It allows that connection to be made in order for them to get these screenings, which they may not otherwise receive, as well as it is a safety net when it comes to treatment for those that are diagnosed and don't have the coverage for that treatment. IBCCP is that connection between Medicaid in order to allow for that treatment to happen. And right now, that connection, the governor is proposing that to be cut. So this is a dire situation for women in the state of Illinois.
It's funny that you mentioned that. We were just at a meeting last week in Springfield, and they mentioned that only 30% of eligible women for ACA have migrated into the insurance plan. So it's a pretty low number, and a big reason for that, they said, was literacy. That people don't really understand what it means to have insurance and how to utilize it. So I think we have a caller. Caller, you're on.
Good evening, ladies. How you doing?
Good.
Thank you for calling.
This is the deal. The state is, by the last, look at the county office of the state of Illinois, is $100 billion in debt. Now, the taxpayer, we got all these other hospitals that have been getting breaks in terms of their property taxes and other taxes sent in order for them to pitch in to do their fair share. Now, if we get these hospitals to pitch in to do their fair share, won't that close up the gap some? And then if that is the case, then why are we not pushing these hospitals to do their fair share since they're getting these tax breaks?
Thank you, caller. You mentioned that for the hospitals to put in their fair share. It kind of leads into one of our programs. We have our Beyond October program here in Chicago, where hospitals have donated mammograms for women who are uninsured. We've originally, when we started Beyond October in 2012, we had a goal of getting 500 mammograms donated from local hospitals, and we ended up getting almost 1,000 donated. So every year we keep getting more and more donations from different hospitals. So we've gotten a great number of donations from the University of Chicago, Mercy, the Advocate Health Systems. I'm probably forgetting some, and I can't remember. But we've had a lot of great hospitals that contribute and donated to women who are uninsured. So they're doing small parts. Again, we would definitely like you to come and join us and get your voice heard, so that maybe we can get some more action around in our communities to get our smaller communities up and running, and people taking advantage of the services that hospitals have available for them. Thank you, caller. All right, so I think we were talking about migrating into ACA and the problem that it's causing, and not being able to fully utilize ACA. But again, we want to make sure that women are taking advantage of the Illinois Breast and Cervical Cancer Program while it's here, and we want to support that program as much as possible. So again, I encourage the caller to get his voice involved. So what can people do to get involved with advocating and show their disapproval of some of the cuts that have been...
I'm so glad you asked. It's very easy to get involved when it comes to advocacy. One is, of course, those local can partner with the Metropolitan Chicago Breast Cancer Task Force. But we would also urge you to get involved by becoming an advocate with ACS CAN, our American Cancer Society Cancer Action Network. It's very easy to do. First step is going online at www.acscan.org, and that shows you our national initiatives. But then if you want to look specifically for Illinois, it's easy. Just to go to the acscan.org/Illinois. It will showcase all of our local initiatives. It gives you my direct information, as well as the information for our state director, as well as it gives you action items that you can act on. If the interest level that you have is in breast and cervical cancer, right now live is a advocacy alert that you can just click on, and it helps connect you with the governor's office, so you can reach out on that, along with other initiatives, whether it's an issue of whether it's an issue for like the Illinois Tobacco Quit Line cut funding, or if it's an issue about healthy eating and active living, and such things as a sugar sweetened beverage tax. All those things are showcased on our website, so you can peruse that at midnight, 8 a.m., whatever you're choosing.
All right, I think we have another caller. Caller, you're on.
Hello, ladies. How are you doing tonight?
Good, and yourself?
Good.
I just kind of wanted to talk about my mom and her struggles with cancer.
Okay,
And it's been...
Oh, did we lose our caller?
Oh, I think we lost our caller.
Try to call back, please.
All right. Sorry about that. But again, if you have any questions for Maggie here from American Cancer Society Cancer Action Network, give us a call. We're at 312-738-1060. All right. Can you mention just a little bit about the quit line? The quit line, I heard about it in the news. That was cut.
Yes.
Abruptly.
Yes. Unfortunately, another cut has happened, and that is for this year, this fiscal year, which means that cuts happened on Good Friday, actually, right before the General Assembly went into recess, and those were cuts put forward by the governor, which really slashed many of our social service organizations and services. One of the things that we were just talking about is the Illinois Tobacco Quit Line were zeroed out for this year, meaning between now and the end of July. As a result, last week, they shut their doors. They had to lay off all 27 of their staff and are no longer able to assist people in the state of Illinois through the quit line. This means that Illinois is the only state in the United States without a quit line. And this is a vital resource for our hospitals and our other agencies. All cessation refer to the Illinois Tobacco Quit Line. And this is something that now we are this void of services. And it's something, too, that was actually funded not by taxpayers. It was funded by the Master Tobacco Settlement. And that is money that was directly allotted to the state in order to provide these sort of services. So that is one other issue that we are completely alarmed with as a decision for funding cuts that were decided upon by the governor's office.
And that's important for us, too, working in breast cancer, because that's one of our modifiable risk factors that, if you stop smoking, you can reduce your risk of breast cancer and other cancers as well. So definitely something that we wanted to talk about with our elected officials. You know, needed programs. So we mentioned how that someone can get in contact with your organization.
Yes.
Who usually volunteers for the Cancer Action Network?
Oh my goodness. Volunteers come from everywhere, from southern Illinois to northern Illinois to eastern and western. We hit all over the state. We always say, you know, it's our boots on the ground, or we're a strong tree that is only as strong as our roots and our branches all across the state. And those volunteers are everyone. They're our mothers, our daughters, our sisters, our fathers, our brothers. They're doctors. They're also someone who is a business owner in the community. It can be anyone. All that matters is that the issue of cancer is a passion and is at your heart. And then we give you the tools. We put that together and we provide those to you so you can strongly and safely and accurately advocate on issues that are important to you.
Great. So what are some of the responsibilities of volunteer?
Oh, the volunteer levels of responsibility really are decided upon by the volunteer. There's the first step with signing a petition. Maybe it's a petition for quality of life legislation at a national level. And then they become a volunteer in the way of, we know that that's an issue that's important to them. So we'll follow up with that. So it could be something that you're a volunteer where you're willing to sign a petition. Well, then if you've given your email, you can get involved with email notifications. It could be something local going on or national going on. If you've indicated that that's an issue important to you, we're going to reach out to you on that. Then there are other levels. One I'm very excited about that's coming up actually next month is volunteers can take the level of responsibility to go to Springfield with us and be trained with our Illinois ACS CAN advocacy volunteer training, and then the next day actually participate in our day at the Capitol, where they come face to face with legislators and let them know where they stand on certain issues around cancer that are cancer related, and ask them to do the right thing and support those issues or vote against those issues if it's not something that we see as beneficial to cancer patients and their families.
Again, one of our major issues that because we'll be going there the other two, we'll all be down there in May, but we're really going to be pushing to support and keep the Illinois Breast and Cervical Cancer Program a viable program for women who are uninsured and low income, making sure that they're getting those basic preventative services covered, and making sure that everyone has access to high quality care.
Exactly. And that is the cornerstone of what our volunteers and our constituents across the state will be asking our legislators. We know that, exactly as you said, Tarnika, the Illinois Breast and Cervical Cancer is that safety net, and is essential to connecting patients without insurance, individuals without insurance, into their screenings, and once diagnosed, into that treatment option. And we need to fight for that.
Yes. All right. So you mentioned that there's a training in May. Is there ongoing training for volunteers, or how the training process?
Sure. Well, volunteers, again, it's at the level that they are interested in. There are those opportunities like to go to the state day at the Capitol, which is like a lobby day. But then when individuals want to stay in tune and be aware monthly of what's going on, we have a monthly advocacy action call that volunteers are invited to participate in at their leisure. Again, those calls are always recorded. So our volunteers that are working that evening or unable to join us, they can listen to that at their leisure. And then we also have our advocacy email alerts that go out, whether it's things just keeping people abreast of where issues are standing, or actually action alerts that are telling people this is happening. If this is important to you, please take action today. Email the governor, email your legislator. And we make it easy. We do all that work for you. We draft an email, you tailor it to what really represents your opinions, and then we already have the email connected for you.
Okay, great. So again, can you give us the information on how someone can get involved and be a volunteer for ACS CAN?
Sure. Easy as going online to www.acscan.org, shooting me an email, or signing up online, or signing one of our petitions. If you do that or send an action alert, you're automatically in the system.
And we definitely would love for you to join us in Springfield. The training is May 13th,
Yes.
and the actual advocacy day is May 14th. How can someone get more information about the Advocacy Day?
The Advocacy Day, sure. We actually have the save the date online, and our registration is closing out this week. So go online tomorrow and register
now.
if you want to. Reach out to Tarnika. Email me. Actually, my email is right on that website, and let us know that you're interested. This is something you want to do. You want to sign up. You want to come down. You either want to come down on the bus that's coming down for our day at the Capitol, or you really want to do the in-depth 2-day experience. Let us know, and we will get you connected.
All right, so someone is interested in really getting their voice heard, but they can't make it to Advocacy Day. What is their best option?
Honestly, the best option I already mentioned is just to email me to let us know that you're interested. If there's an area that's already posted, know that when you go to our website, on the right-hand side are the topics that we're addressing right now here in Illinois. And there's fact sheets on there. There's things that you can read and be connected to, so you can feel more secure with the issue and know, is this something that I want to be involved in? And when you are, you just take action on that. It's an easy step. It's just that one stop at the website, and then you decide how much further you want to go.
Great. And I always tell people to take advantage of those fact sheets, because if you can't go to Advocacy Day, maybe you can set up a meeting with your elected official in their home office and meet with them and talk about those main points that are on those fact sheets. So definitely take advantage of the information that's on the web so that you can set up your own meetings. And then even if you can't do the Advocacy Day, you can always take advantage of future training events. So.
And those aren't only in Illinois. That's something that we're part of a national network. So our top volunteers representing congressional districts all across the state, all across the country, come together in September. And then we do that as well statewide, which is what the May experience is all about.
All right. So again, can you share the information how they can get involved on your web?
Sure. It's just going to acscan.org/Illinois, specifically, if you want to look for Illinois information, or just going to acscan.org, and you will see listed up there at the top all of the campaigns we're working on, and you pick and choose what works for you. And we welcome you and thank you for getting involved in our advocacy fight for making cancer a national and statewide priority.
Well, again, is there any last additional final thoughts about ACS CAN that you want to share with people that they don't know, or things that they will be surprised to hear, anything that you just want to share?
Oh my goodness. Really, the American Cancer Society Cancer Action Network is here for you. That's why we were created. The American Cancer Society created us, like I said, in 2001, in order so we could really rally advocates across the state and across the nation to help us and help you make cancer a national and state priority. We're very easy to get involved with. Again, you just choose what level is the level that you want to advocate for, and what topics, what issues are important to you, and then we put the tools together. We put those efforts together to make that happen. Whether it's rallying people at American Cancer Society special events that happen across the country, whether, like you mentioned, whether it's Relay Recess or Relay for Life, making strides against breast cancer, all these events. And here in Chicago, there's the walk and roll, as well as Determination with our Chicago Marathon. Those are all American Cancer Society sponsored events that happen across the state and across the country. And what they do is they integrate the ACS CAN, the Cancer Action Network, opportunities to let their voices be heard on issues. Because if you're coming to one of those events, if you're partnering with the American Cancer Society, if you're partnering with Metropolitan Chicago Breast Cancer Task Force, cancer is something important to you. It's something that you're passionate about. And so we just help harness that passion and put it into words that you can utilize with your legislators in Springfield and in Washington, D.C.
That's great. Like I said, we partner with the American Cancer Society Cancer Action Network all the time. Our volunteers volunteer with the American Cancer Society.
Exactly.
So it's always a cross. So we love working with them. So we definitely encourage, the caller that we dropped, I'm sorry, that if you want to really make your voice heard and be able to support your mom, definitely reach out to both the task force as well as ACS CAN, and we can definitely make sure that we can get you the resources needed.
Exactly.
All right, Maggie, thank you for being our
Thank you,
guest
Tarnika.
today.
I appreciate it. Thank you so much for the invitation. And callers and those watching, we appreciate you for all your future advocacy efforts that you're going to get involved in.
All right. For more information about what you heard today, contact the task force at 312-942-3368, or you can check us out on the web at chicagobreastcancer.org. Again, we're on social media, both Facebook and Twitter, with our handle being MCBCTF. I would like to thank you for watching today's show. We're here every third Tuesday at 5 p.m. discussing issues of breast cancer and health equity. My name is Tarnika Manning with the Metropolitan Chicago Breast Cancer Task Force. Have a great evening.